Hi, I'm Dr. Erica Latcher from Spring Hill Equine and the podcast Straight from the Horse Doctor's Mouth. Today we're going to talk about all things joint injection, from what joints we can inject to what products we can put in them and everything in between. Let's start with a special shout out to our patrons. Without you guys, we can't do what we do, so thank you so much. If you'd like to be a patron, you can check it out on our website, springhillequine.com/podcast, and you'll find all the information there on how to become a patron. All right, the most common joint that I get asked to inject on a regular basis is the stifle and the hock. But there's a lot of joints that we can inject all over the body. Stifles and hocks happen to be relatively easy because we can essentially see the joint. Our markers where we're going to put the needle are really close to the surface. We can get fluid out of the joint, so it tells us we're there. A lot of easy things about stifles and hocks. But we can inject all kinds of different joints. For example, in the back, we have not only where the spines come together, where we think of when people say kissing spines, but there's also joints that happen at this level where the vertebrae actually articulate. So that happens down at this level. We've got joints there we can inject. We have the sacroiliac, which is in this area of the back. We can inject that joint. We can inject elbows. We can inject shoulders. One of the other big ones that you may have heard about are cervical facet injections. And these, we come into this area of the neck. We need to ultrasound image the joint itself because it's not so clear where things are here. So using the ultrasound, we actually put it on and then we inject using a long needle, looking at the joint itself as we inject. So that's cervical facets. But there's some different things that happen with each of the joints we inject. For example, if I'm injecting a cervical facet, I'm not as worried about that joint instantaneously being in a dirty environment. For example, if we're thinking about injecting a coffin joint, where I inject right here on the front of the foot, then nearly instantaneously, that has the potential to be in the dirt somewhere. So we need to think about preparing the joint very carefully, and then covering it so that it's okay when we're done with the injection, so that it's not exposed to dirt. The other place that happens is the navicular bursa, which we inject on the backside. So again, same thing. Lower joints, I tend to worry more about dirt being involved, and I want to do some post-injection things to make sure that everything's as clean as possible post-injection. Versus, if we think about like a stifle, this is a pretty clean area generally. It's pretty safe for me to inject and not worry too much about dirt happening. The next thing we look at when we're looking at joints is that some of them are what we call high motion, and a few of them are low motion. So when we think about low motion joints, believe it or not, we think about the hock joint. And that's because in the hock, we usually inject the lower joints and not this hinge joint that you can see she's bending right now. We're actually doing the lower joint, and that joint absorbs the rotational movement, which you can see that that's then why we sometimes need to inject that joint, is it's absorbing this motion, and over time, that degrades the cartilage between those two pieces. Those get injected with a different combination of drugs typically than we do a high motion joint. Like, for example, if you look at her stifle, you can see again, much like the upper joint of her hock, it's bending right now. And as most horses go through what they do, their stifle goes through a big range of motion, and so we need to be careful what we put in there. The cartilage is going to be super important, and we need to keep it as happy as possible. So we evaluate different joints for what they do and what we inject in them. The other place that we can inject that isn't a joint is what we call tendon sheaths. And there's a couple different places on the body where we inject those, but the most common is on the back of the fetlock. So this area right here. And this tendon sheath has a tendency to get inflamed. It can be inflamed by wax. It can be inflamed by inflammation within the tendons and ligaments. There's a number of different reasons we can get inflammation there. But getting steroid into those or getting hyaluronic acid, something like that, into there to reduce inflammation quickly can be really important. We then have to make sure those horses go through a healing process, but getting inflammation out of tendon sheaths is really important for the long-term health of a horse. So what are some things you can do to be better prepared for joint injections when your veterinarian shows up? One of the big things is having a clean horse. We are going to do some hardcore scrubbing when we go to inject these joints. And having a horse who's already clean is really helpful. When we see that gray horse come up out of the pasture and they're manure green with a combination of mud, brown, and black, we cringe because we know we're going to be working hard for a long time to get this horse clean enough to inject. If it's winter time and they're furry, and like I said, you have a feeling there's going to be joint injections, talk with your veterinarian ahead of time about maybe it'll be worth doing either a body clip or a spot clip of some areas to make sure there's less hair so we're able to get it clean. It's a really big deal that everything is super, super, super clean when we do this. And to do that, we take a combination of an antibacterial scrub. I like chlorhexidine, but some people like betadine, just depends on the veterinarian. So we're going to do chlorhexidine and alcohol scrubs on an area until we have that, the cleanest it's ever been. And we're going to wear gloves when we do that to make sure the bacteria from our hands don't get onto the skin as well. The thing about skin is we can never get it 100%. We're just trying to reduce that population. There's also, you may see some veterinarians clip the skin before they go, and some of us don't. There's some areas where the science goes both ways, and that's one of them. With clipping, you run the risk that you create tiny hairs that can go in the injection. So I'm of the not clip camp, but there's plenty of people who are in the clip camp because they worry about the extra hair being a source for bacteria to hang out. So either way, may clip, may not. But I say if I have the opportunity and it's wintertime and there's a big winter coat, I will ask owners if they can pre-clip the area so we don't have a lot of extra hair in the way and we don't have a lot of those little hair pieces on the day I come to inject. Okay, what should you do after your horse gets their joint injected? So in general, do not instantaneously go out and ride that horse the hardest you've ever ridden them. When we are doing joint injections, it's because there's an issue going on. And we want to make sure that the area we're injecting has time to heal. So typically, after I do a joint injection, I ask that the horse is rested for at least 2 to 3 days, depending on what's going on. I may say longer if there's an actual injury that we're assisting the healing process with. But at the very least, I want that horse to do minimal for 2 to 3 days of no work, and then maybe, go out for a little trail ride, 10, 15 minutes. Not, let's go work on Piaffe because they got their hocks injected, it's time to go to it. Nope, let everything calm down, let the drugs do their job, and then you can go ahead and step them back up into work. You want to try to keep those joint injection spots clean for at least a few hours while the body seals over the hole that we made with a needle. Sure, it's a small hole, but it's still a hole and bacteria can go in. You also want to keep a close eye on your horse for a few days and make sure that they aren't showing you any indications of lameness, and increased lameness in particular. And we'll go over all that in a minute. But post-injection, it's mostly keeping a close eye on them. Your veterinarian may or may not prescribe an anti-inflammatory like Bute post-injection. Sometimes I do, sometimes I don't. Just depends on what I'm doing, what product I've put in, and what's going on with the horse. But again, just keeping them as clean as possible for the next few days. Sometimes that's a challenge. And following your veterinarian's advice as far as the work schedule. All right, so we've talked a little bit about what joints we can inject and where they are on the horse. We've talked about some prep that we do and that you can do for joint injections, and we've talked about how to manage your horse after injections. So let's talk about actual injections, shall we? There's a couple ways that we can inject joints, and the simplest is we literally just take a needle and syringe, we drop the product we want, and we use that to inject into the joint. This works really well on joints like stifles, hocks, fetlocks, the biggies where we can point to it, we can say, there's the joint. I put my needle there and I'll be in the joint. There's some joints that's a lot harder to do for. The big ones that come to mind are cervical facets, or the joints in the neck, and the sacroiliac joint. For those, we need a little help. So for those, we often grab an ultrasound probe so that we can put it onto the body. We can say, oh, there's the joint that I'm looking for. And then we use spinal needles. This is a short one. Here's one we would use for like a sacroiliac joint. This always makes owners a little squeamish, but it's really not that bad. It's just a long needle. And we'll take this needle, we direct it along the edge of the front edge of the ultrasound probe, and we can then see it on the ultrasound screen, and we can watch it go into the joint that we're doing. And again, this works really well for a lot of the deeper joints to make sure that the product we're using can go in there. The trick to all of this is that we need to stay super sterile. So when we're doing ultrasound guided injections, we'll also have the ultrasound probe either sterilized, or we'll have it in a sterile sleeve so that everything is protected. Just adds another layer of complication to joint injections, that's for sure. So let's talk a little bit about what we're going to put into some of these joints. We talked about high motion versus low motion joints when we were on the horse, and that makes a big difference in our choice of product. So low motion joints like Hawks, SIs, we will inject with a little bit harsher steroid typically. Some of this depends on what we can get, and so you won't see Depomedrol, which is one of our choices, on the table right now because we can't get it. But in general, we can go with a harsher steroid in those environments. And by harsher steroid, we mean something that is not as kind to the cartilage that covers the ends of joints. And that's because those low motion joints, they just don't work the same, and so their cartilage doesn't set the same. What we're doing when we go into those joints is really trying to reduce inflammation. So we'll hit them hard with a steroid to reduce that inflammation and then let the body move on. When we're talking about high motion joints, we need to preserve the cartilage as much as we can. And so we'll go to so-called safer steroids like betamethasone or triamcinolone. We're going to get into the problems with steroids later, so just know that we'll get there. We're just not there yet. With most of these products, we also use a little bit of an antibiotic as well, because when we go into the joint with steroids, one of the things we're concerned about is shutting down the immune system in the joint. So by adding a bit of antibiotic into there, we help just prevent some of those infections. That's also why our prep process is really, really, really important. Some reasons that we go for steroids as a first line is if we have a joint, for example, that is really inflamed and just really ticked off at the world. There's nothing more potent than a steroid for reducing inflammation. So sometimes that's going to be our go-to to reach for that, like I said, really ticked off joint so that we can get inflammation down in a hurry. Inflammation in a joint is not great for the joint environment. All of those inflammatory products are really bad for cartilage, soft tissue, the lining, the synovium. Those things are all just not happy in an inflamed environment, and sometimes it's really important that we just make it go away. And so that's where we're going to use a steroid as our first grab for those joints. But there's some other great products that are on the market, and you've probably heard a lot about hyaluronic acid. This is one brand. There's different brands on the market, and every brand will tell you why theirs is the best. I'm not sure any of that is real, but you do want a high molecular weight one for some reasons. I don't know of anyone using low molecular weight for joints, so not a huge concern there. But anyway, hyaluronic acid is the thing when you think about the goo kind of part that we inject into a joint. This is very, very slippery, and it has kind of some stick to it. Its job in the joint is to work as hydraulic fluid, so that when the joint compresses, so think about walking on your leg, your knee is going to hit the ground, and your two bones are going to compress towards each other. Hyaluronic acid prevents that compression. And so the thicker it is, the more viscous it is, theoretically the better it does. Hyaluronic acid, though, also has some other properties of being an anti-inflammatory. Not as potent as a steroid, but it's why we'll often put the two together so that we get a replacement of the hydraulic fluid of the joint, and then we also get potent anti-inflammatory. So again, that's where we'll often put those two products together, and we've done that for for ages and ages, heck, as long as I've been a vet, and let's not talk about how long that is. But these are a very common combo product of a steroid and a hyaluronic acid. Now, recently, there have been some newer products that become much more available to the equine market that take this concept and go to the next level. The two biggest ones on the market are Noltrex and Arthramid. I'm a much bigger Arthramid fan for reasons, but those products stay in the joint for a lot longer, and they do a lot more things than hyaluronic acid does. Hyaluronic acid has, sort of a mild anti-inflammatory effect, as I said, and again, it acts like a hydraulic fluid, but it's easily broken down by the joint environment, especially if it's inflamed. Some of these newer products, like Arthramid, go into the joint and very quickly work to head for the synovium, which is that lining of the joint capsule, and prop it up and tell it that everything is okay. They calm down the inflammation. They'll go into cartilage gaps and sort of fill it in a little bit. It's never back to factory default, not saying that by any means, but they put a little bit of a gel in there. So it's sort of like Fix-A-Flat, where it's never as good as it was when the tire started life, but it certainly helps. And again, the thing about both of those products is they're very anti-inflammatory for the joint. They just do a lot of good things. That's Noltrex and Arthramid. So for the products like Noltrex and Arthramid, a couple of things that we need to keep in mind is that oftentimes once they are in the joint, they are there for a much longer time frame than our hyaluronic acid. So we have to be really careful that we are really, really, really sterile. I know we talked about how we're sterile when we do this, but we have to be like next level sterile when we do these products. I prefer to do them at the clinic where I control the environment a little bit better. I don't like to do them in dirt aisle barns. Like I said, I just like everything to be another level of clean when I'm doing these products. The other thing about them is because they're synthetic products, they both add more cost to the process. In my experience, and I've used a decent amount of Arthramid at this point, it's been worth it. I've had horses that we've injected multiple times with High-Visc or even Biologics, which we're going to talk about next, and I haven't had the same results as I've had with Arthramid. So definitely worth a discussion with your veterinarian that you have a great relationship with if one of these products is a better answer for your horse. So let's talk about Biologics. And when I talk about Biologics, you're probably like, what the heck is that? But you've probably heard a lot of PRP, ProStride, IRAP, trying to think of any of the 8 million other ones. There's a ton of them out there. Stem cells that all represent something that we create by pulling blood from a horse or pulling bone marrow, processing that, and then creating something that we put back into the horse. And it changes on a regular basis as to what we have. For instance, right now, one of the new ones is alpha-2 macroglobulin. And again, we pull blood, we process it, we turn it into this thing. The thing about Biologics is all of them are from the horse. That means that we run a really low risk of a foreign body reaction by the horse, and that can happen with any of these products that we've talked about so far that we put in. The body can look at it and say, that's a foreign body, I want that out of here. With Biologics, that's a much lower risk because we're pulling it from the horse and we're putting it into the horse. And we don't ever pull them from that horse and put them in that horse. You're always pulling them from one horse and putting them into the same. The other thing that we're doing is we're using the body's own natural systems that are in place to combat inflammation. And we're activating the repair mechanisms that the body has. So we're taking everything the body does naturally and we're just amping it up. So we run a much lower risk of side effects. And that's a really good thing because while steroids are great and we've used them for a long time to give horses a better quality and quantity of life, they have some really bad side effects that we don't really run into with Biologics. Here's the trick to Biologics though, and I don't really have a great answer for this and no one does. One of the hard things to do is to quantify what we're getting out of that horse. So let's say that I've got this horse here and I pull blood from her and I want to turn it into PRP or platelet-rich plasma. I don't know that I am getting super high quality PRP. Now, I can do some testing on it and see how many platelets do I have, but I don't know if she responds well by creating good cytokines, you know, some of those molecular factors that are the magic that's in biologics, we have a really hard time testing. And one of the groups of horses that has a really hard time doing this are any horses under chronic stress, so think about show horses, and older horses. So when we're doing the biologics on some of those and it's not working, it may be that we need to reassess how the horse is doing and that what we're getting out of their bloodstream is not a quality product. So again, that's a high level topic to have a conversation with your veterinarian about. But if your horse is Cushingoid, then a biologic from them may not be the right answer because it may not respond appropriately. The other thing about biologics, and this is more for your veterinarian than it is for you, the horse owner, is a new one comes on the market all the time. And I do mean all the time. It's really important that you do the work to look at each one of them and decide, is the science there to say that this is a viable product, or is it just you pull some blood, do some magic and some mumbo jumbo, and supposedly something comes out the other end. And again, there's not a great answer for that, but just know that it's absolutely a thing, that there are kits for all kinds of different things out there that may not even work. All right, let's talk about some problems that can happen from joint injections. And I'm first going to talk about the two biggies that are always a risk. And one is infection. And we do absolutely everything we can to address that. For example, we scrub joints really, really, really well. We make sure that when we wipe with alcohol on the spot where we're going to go in to inject, that wipe is absolutely clean, obviously to the naked eye, but that it is clean when we consider that joint ready to go. That's one step. Sterile gloves are another step. And I have to say, this is where I failed. When I started, like, I was the new kid on the block that was wearing sterile gloves to do joint injections, and no one else in my area was. And now I don't think you'll find anyone who doesn't inject without sterile gloves, but if they look like they're about to, make sure that they put on sterile gloves. We also use all new products every time we go into a joint. I mean, heck, we use new products every time we go into a horse, but you really want to make sure that you are using very new stuff when you go into a joint. No reusing needles, nothing like that. In fact, if I have any doubts about how a needle is doing, if I held it in the air too long before we got things going, I will swap out needles because it's that big a deal. It's also where we inject, and this is a bit controversial, but I inject a small amount of antibiotic into most joints that I can, especially if I'm doing steroid. There is a camp out there that doesn't, and the science behind that is very good too. So just know your vet may or may not inject antibiotics into the joint along with the joint injection. But for me, it makes me sleep better at night. But the science is really out on that. There's kind of not a straight up pro or con, so I get to do it because it makes me sleep better at night. So that's infection. One of the other things about the products, like Noltrex in particular, and some of the newer gels that are out there, is you have to be really, really careful with infection, because if the joint gets infected when you've put one of those products in, it's nearly impossible to lavage the joint and get it out. It can also be tricky to see if a joint is infected after we've injected it, because they also do something which we call flare. And flare is just when the body responds to the material we've put in and says, woo, intruder, and it activates the inflammatory system. Flares usually happen very quickly in the time frame of a joint injection, usually within about 12 to 24 hours. The horse is extremely painful. We get them onto anti-inflammatories like bute or flunixin, and they come around pretty quick. Versus infections usually happen around the 3-day post-injection time frame. And again, those horses are extremely painful. The biggest problem with joint infections is, just like joint infections from any other cause, they are life-threatening to a horse. So we have to very aggressively get this horse headed to a surgical facility for that joint to be lavaged out very aggressively so that hopefully the infection doesn't take hold. And again, the other problem is most of the time if we have infections with these, we've put steroid in, and that steroid has reduced the ability of the immune system to fight infection. So that's why joint injection infections, say that 3 times fast, are particularly concerning for veterinarians. And I cannot tell you the nights I've lost of sleep when I've had a horse that's been a little bit sore. Luckily, the most recent one that I can remember, the horse, I injected it 3 days later. It was extremely painful and I was terrified, and it blew an abscess when I looked at it. I've never been so happy to see an abscess in my life. So just something to keep in mind on why your veterinarian may be a little bit over-sterile and overprotective of the environment when they inject a joint. That's a good thing. The next problem that can happen, and again, much more common with steroids, is laminitis. We don't fully understand this. We can't recreate it in the lab, so it's been very difficult to study the link between laminitis and steroids. This is a huge risk if your horse is overweight, yet another reason for your horse to not be overweight. But every once in a while, injecting steroids into a joint will cause a change in the insulin system and the horse will develop laminitis. It's generally bad. They get an incredibly horrible episode of founder and we have to be very aggressive trying to save their life. One of the new things that has come available for us that is going to be a game changer in this area is stall side insulin testing. So I can look at a horse and say, I don't know how I feel about this horse in terms of their weight. I'm highly suspicious that maybe they have some metabolic stuff going on. Let's take an insulin and see if this is a horse that has a high insulin, and maybe we can go after, we can treat this joint with some steroids because we've got a low insulin, and I know that I do. If I've got a high one, no way am I gonna put in steroids in there. It's just too big a risk. The other nice thing though that with the products we've talked about, for example, Arthramid and any of the biologics, is we very strongly negate that risk. In fact, I don't know, it's hard to say with horses, but I don't know of any cases of laminitis secondary to those products because they don't affect the insulin system at all. So just to prove to you that horses absorb steroids systemically from their joint injections, that's how that happens, right? We put steroid into a hock, it's absorbed systemically from that hock, and that causes the horse to founder from that injection. So laminitis is a biggie, and we're always trying to make sure that we don't cause it. One of the other problems we can create with joint injections is actually covering up a problem. And again, this is a big deal with any of these products. But I can put something into a joint that is injured and I can make it feel good for at least a few days and sometimes a few weeks. That doesn't mean it's the right answer. That joint may need time to heal. Maybe we have a soft tissue problem going on and me putting an anti-inflammatory in there makes it feel better, but doesn't allow the body to heal it. I will say that this is sometimes where we will use biologics and say, okay, we're gonna put a PRP or we're gonna put stem cells, something along those lines, into the joint. And now we're gonna give that horse time so that they can use the product we've put in there to heal. More often than not, though, I see cases where horses are repeatedly injected, sometimes as often as every 6 weeks, so that they can continue to do whatever their job is, and they should have had time off to heal, and instead the joint is now trashed because we have hidden the pain signal the body was trying to send to say, please, I need some time off. So the biggest thing that I see with joint injections is making sure that we aren't covering up a problem that the body should have had time to heal in the first place. One of the ways that you can help your veterinarian avoid this is by allowing them to find a diagnosis. Letting them take the time to look with ultrasound, x-rays, maybe even MRI to figure out what's going on that's actually causing the lameness that's making your horse sore. Letting us find the reason so that when we're using these products, we're using them in the appropriate place, the appropriate amounts, and the appropriate product, to be quite honest. And we're then allowing your horse to do what they need to do after to fully recover, instead of just putting a Band-Aid on a problem and saying, go do a thing. The final problem we're going to talk about is sort of related to repeatedly injecting joints, and that's that in particular steroids, and this is the worst offender when it comes to the repeat injections, can cause mineralization. So they cause the cartilage to mineralize, they cause the joint capsule to mineralize, they just do horrible things to the joint over the long term. And you can look at joints and say, that one has been injected way too often, and there hasn't been enough time between to allow the body to actually rest and heal and do what it needed to do. Once we have a joint that is mineralized, it does not respond to joint injections anymore. So again, being aware that your horse should not need to be injected every 6 or 8 weeks. In fact, I am generally trying to keep my horses on a year to 18-month-ish schedule, not maintenance, but schedule between injections. So what do I mean by a schedule? I mean that you, the rider, say to me, the veterinarian, they're just not quite right. Like, we've been really crisp with the lead change from left to right, and now it's a little bit or they've gotten heavy in the right rein, or something is happening that has changed what they're doing. And you say, let's do an evaluation and see if there's a lameness somewhere. And then we go from there. Hocks, stifles, coffin joints, they're not done on a schedule where they come in every 6 or 8 months. It's not like your car. You don't change the oil every 3,000 miles. It does not work that way. You should only be injecting a joint if the horse is telling you it needs to be injected. And if you're injecting it every 6 or 8 weeks, there's something very, very, very wrong going on, and you need to reevaluate everything. There's a lot out there on joint injections. A lot of it are myths, wives' tales, and sketchy ideas. Hopefully this clarifies some of it for you with how to prepare your horse, what products we use, and methods that we go for. If you've got any questions, drop them down below, and we'll try to get them answered as fast as we can. Again, a special shout out to our patrons. Thank you so much for all you do for us.